And I'm really excited because we have some more technical people, we have some clinicians, I have a doctor, a nurse. It's really amazing to have a group like this to be able to discuss this important topic. So we're going to go down the line and introduce ourselves. So Sandeep, how about you start off, introduce yourself, tell us a little bit about yourself and your organization.
Yep. Thanks, John. Hey, everybody. My name is Sandeep Misra, and I lead the healthcare vertical sales for Rackspace. We obviously are one of the biggest partners for Dell when it comes to healthcare, and excited to be here. I've been in healthcare for almost 15 years now, working for different organizations, startups, and prior to Rackspace, I was at AWS, managing some of the most strategic partnerships. So happy to be here and look forward to the conversation.
Great. Welcome, Sandeep.
Hello, everybody. I'm George Morris. I'm the Global Healthcare CIO for Dell Technologies. I do solutions and strategy for some of our largest customers globally. 30 years in healthcare, over 27 of that as a CIO. My specialties have been on the transformation side, as well as helping organizations from a security perspective.
Thanks, George. Heather?
Hi, everyone. My name is Heather Hudnall, and I'm from NTT. I am a Director of Clinical Innovations in our CNIO, and I've been in healthcare for 16 years, been a nurse for 16 years, but been on the health IT side for the last decade. Transitioned into the health IT space when I left the bedside, went to work for Cerner. I'm in Kansas City, so I think that's just a rite of passage.
That's a feature.
Yes. Was in emerging technologies, brought to market CareWare Connect. I helped design it from a nursing perspective, and that's one thing that I'm really passionate about, because nurses, a lot of times, technologies that meant to help us and help us deliver better quality patient care can actually do the opposite and create more workarounds and frustration. So my mission is to make sure that we have nurse-friendly technology so we can deliver better patient care.
A technical nurse. Don't we love it? I love it. Welcome, Heather. Amanda?
Hi, I'm Amanda Heidemann. I am the Chief Medical Officer and Chief Medical Information Officer at KeyCare, which is a nationwide telehealth company built on Epic. I'm a family physician by training. I do still practice, which is a little bit of a unicorn being in the tech industry. But I started my career in IT when a large health system was looking for some poor victim to do the paperless practice. And that was the hook way back in the day. So I've been on the IT side for over 20 years now, and it's been a fun adventure.
Yeah, definitely. So Amanda, how about you kick us off? Like, what is the experience and what is the impact on a healthcare organization when a breach happens, when there's downtime, when there's a problem with the network? Talk about it.
So the only words I can describe from the clinician side are abject terror, especially when you've been used to using an EHR and used to using electronic resources. It is absolutely terrifying because we've come to rely on those things. And one of the scariest patient situations I was ever in was during an EHR downtime. And everybody's kind of off their game. You're off their feet a little bit. And organizations tend to wait too long before they actually dig out that downtime box, before they decide that it's something that they need to go to plan B. And meanwhile, the clinicians are just struggling. And you're trying to take care of patients. You may not have labs. You may not have things that we take for granted every day, such as the abnormal laboratory values being flagged in red. All of that is gone. I mean, and we know what the abnormal values are, but you're so used to having the technology augment you and double check you that it's really frightening. So I think that's why it's so important for organizations to have really solid downtime planning, and not only have a great plan, but also rehearse it regularly to make sure that everyone knows what to do, that there's no question when it's time to go to that plan B, and everybody knows how to act and how to take care of patients. And it's not just in the short term. We've seen it more than we like, that organizations are on a downtime, for days, weeks, months, depending on whether it's a ransomware attack or something else. So the clinician impact is absolutely terrifying.
It's amazing how dependent we've become on the technology, right? I mean, that's what you just described to me. And I forgot to mention too, if you're live tweeting, I see some people on their phones, if you can use the transform HIT hashtag, and then after this, you can see all the things that people are sharing. Be sure to use the transform HIT HIT hashtag. And if you have any questions, give me the universal hand. We're happy to take questions from the audience as well. So I'd love to hear. Maybe you could add, George, go ahead, and then we'll hear the nurse perspective as well.
Yeah, I think there's a couple things too to help support that. On the IT side, it's really important for folks to have a good plan in place. I've been part of some breaches, part of an organization that was breached in 2017, help them get out of it. What I found really interesting was organizations that even have done some tabletop exercises aren't able to be confident that the recovery plan is going to be successful. And they take a lot of time on war room calls trying to figure out exactly what we're going to do, when we're going to do it. The problem with that is you're not giving the clinicians an SLA. You're not coming back and being able to say, look, we're going to be down for the next 24 hours. Implement your plan, staff up, and we'll get back to you. So once you get confident that you've got a good plan in place, you've practiced it, it allows you to hit those SLAs. So we see organizations not being able to do that. So don't take time to make that decision. Be confident in your plan.
Sandeep?
From a healthcare organization perspective and the impact that they go through if there is an event, cyber attack or some sort of a breach. I mean, patient care at the end of the day is the most important job of a healthcare institution, and it will get impacted. It will get impacted in a manner where it's either, slowness of response, or patients being able to see the physicians, or there's a longer wait time than even usual, right? So all those are those the ones that impact the patient care at the end of the day, the quality of care, and that's what's most important to healthcare institutions to be able to solve. And besides that, the cost of it. I mean, the cost component is massive. An average healthcare security breach it costs about $10 million. Our cost to the health system is about $10 million. And it's the most, healthcare industry is the most targeted when it comes to security breaches and cyber attacks and such. So all these points that, the panelists have made obviously are very important. But from an impact perspective, I guess patient care obviously being the biggest and the center of all the challenges.
Excellent. Heather, so the doctor said abject terror. What's the nurse perspective on when it goes down? And then let's start talking more like what else can be done to help improve this.
So I would agree with the terror statement, but complete, utter chaos. So we're just so reliant on technology. It does the checks and balances for us. It's second nature. So when all of that goes away, think about like teenagers today, if they lose their phone, the freak out moment. So we have that same feeling. And I've actually been a part of downtime procedures, and everyone just kind of stops. We don't know what to do. A lot of times the downtime preparedness kit, where you may have been trained on it when you first started, and then that's it. So you don't remember what you're supposed to do. And a lot of times the packets are completely outdated, so they don't really offer much help. The impact to patient care is great. I mean, there's delays in care. You can't get stat medications when you need it. You don't know what the last lab values were. And a lot of, the procedures and medications are dependent upon what was that last lab value to titrate this drip. So it can actually impact patient care. There's a lot of scary stats out there that it can increase patient mortality, length of stay, increases cost of care. It also impacts your clinicians. We don't go into work every day and with the we don't want to hurt patients. I mean, at the end of the day, that's not why we're there. We want to help people get better. And so that really does weigh on your clinicians when they don't know if they're delivering the safest care possible, because everything they're used to, their checks and balances, is all of a sudden gone.
Yeah. And what I hear from you is we need to make sure we update our downtime procedures, right? I actually had an incident of that when I was implementing. I worked at a clinic, an ambulatory clinic, and we had a downtime. And we had just the week before updated our downtime procedures. What are we going to do when the EHR is down? What's the process, the short term, the long term, et cetera? And I remember when it went down, I was like, oh crap. It was the chaos exactly like you described. Luckily, we had this amazing health center director who was there named Tina. And Tina was there and she said, it's all right. We know what to do. Remember what we practiced last week, and it just calmed everything down. It was amazing, to your point, that we had procedures that we had practiced, that we knew, and then it just calmed everything down, and sure enough, it came back and we did the procedures. So that's great advice. What would you add, George, as far as what can healthcare organizations do and what should they be doing to prepare for this?
Yeah, I think we've talked a lot about it, the tabletop exercises, but again, I'm going to take it from an IT perspective. IT has to be confident in their abilities to be able to recover from a cyber event. And that requires making sure you have a strategy and technologies in place that allow you to go from a completely a large blast radius that completely takes out your infrastructure from tier 0 on up. So you've got to be confident that you can rebuild, repave your network, all your basic network technologies, all your VMware stuff, and on up, along with the applications. What I see organizations doing a lot is they're concentrating on the data. I'm going to be able to store the data. I'm backing up the data. The data is only one piece of it. You got to look at the entire stack. Now, why is that important for our clinicians over here? Because you've got to be confident in the SLA that you've given to the organization. We've taken out most of the productivity enhancements that an EMR can do out of our clinical organizations. Staffing up is not easy, especially post-COVID. So the organization, you talked about clinician and clinician burnout, the organization is only going to be able to staff up effectively for a period of time, depending on your organizational capabilities. You got to be able to bring it back in that time, otherwise things are going to start significantly breaking, and that's where the costs really start going up. So if you're confident in your abilities to be able to rebuild it, repave it, and at Dell we have ways to help you with that, you'll be able to recover and then support. Because the other calming part is, look, we know we've got an SLA of 48 hours, let's say. All we got to do is get through this. The 48 hours is at the end of the tunnel. IT says, yep, we're on step for that. And now you've got a light at the end of the tunnel. You're going to be able to recover.
Yep. Sandeep, you probably have this conversation with a lot of people when they're working with Rackspace and the SLAs associated. How do you approach it, and what are the conversations you're having with organizations?
Yeah, so most of the organizations, to George's point earlier, too, they've got to understand and be able to monitor the vulnerabilities at all times. It's not just a one-time exercise, right? What you can do is, we're secure, we're done, we'll come back to it in 6 months or whenever the next news article comes out about a healthcare breach. The moment they do that they're doomed for failure. And the problem is that it's not a matter of if, it's a matter of when. All these attacks will happen. They will continue to happen. They'll continue to get worse. Organizations need to evaluate tools that are at their disposal and be on the lookout for innovative technologies. I mean, AI and ML is becoming a big support structure for healthcare organizations. There are tools that do behavioral analysis. Use those for, sort of vulnerabilities and who could be attacking at what time, where. To George's point, go down to application level detail, right? Perimeter-based security, that's great. Network level security, that's great, but you got to get down to the application level and make sure that everything is not just secure, but there is a plan, kind of like fire drills you were talking about, Heather. Let's have fire drills. Let's make sure that when this does go down, what are we going to do? Who's going to do what? Stay calm, because at the end of the day, patients do not want to see their doctors freaking out. That is not going to help anybody. So I think that those are the kind of procedures that organizations have to put in place.
Yeah. Go ahead, George.
Just one more I want to mention. Don't forget, from an IT perspective, once the system comes back up, that's not recovered. And the clinicians will tell you this. If you're down, let's say, a week, now all of a sudden you got to catch up from where your last recovery point was all the way to now. That is a substantial exercise for an organization. So that's the other part you got to practice within your organization, is that what does that recovery work? How are you going to balance the census? How are you going to get orders back in? How are you going to get results that are sitting in the labs or sitting in the radiology back uplifted? You can't load results until the orders get in. Are you going to load all the orders? How is all that going to work? So again, all testing it from front to back to full recovery is important.
That's an expensive drill, George, right?
It is.
I mean, that's an
But it's
expensive.
expensive if you don't do it.
Yeah, it's expensive if you don't. That's fair. That's fair. Amanda, what would you say from a CMIO perspective, right? What can you do to contribute? I imagine, it's like, well, a lot of people look and say, well, that's the CISO's job. And every CISO I've talked to says, no, it's the whole organization job. But what would you see as the things that we can do to help ensure the resiliency? But also, I mean, to Sandeep's point, it's third parties. I mean, we saw with Kronos, how long was it down for so many organizations? What's the CMIO perspective on this?
Yeah, I think the role of the CMIO, a lot of times we are the bridge between the business and the technology arm, or between the clinical arm and the technology arm. And part of our challenge is to make sure that we understand things in a way that we can translate it to our clinical constituents, to make sure that they understand the value of participating in the fire drill and understanding how the system works, and also being able to provide the voice of the clinicians and the voice of the patients as those planning and preparation phases are taking place. We're talking about cyber attacks. One of our weakest points is our own people that work for us. And, talking about phishing and spear phishing and all the things we see in our annual training, really able to help be out there advocating to the physicians why this is important. Even things, we still see people loaning each other badges, or people that don't understand badge in, badge out is one person at a time, no tailgating through the badge zone. Really being able to advocate for that and be able to kind of go back and forth. I think the patient perspective is really important as well. And so I was actually part of a health system data breach and had identity theft as a direct result of that. And being able to help all the people at the table understand these are real people in real lives. And, someone was running around trying to get Discover cards in my name and things like that. Because many of us in our organizations, we have millions of patients in our databases that are impacted by this. And, it's beyond just the clinical care. These are things that can haunt our patients for years, can lead to medical bankruptcy, all kinds of things once that insurance information goes awry. So, we like to be the bridge. We like to be the translators. And it's good for us to know as much as we can and to share between all the parties at the table.
So I want to get to the patient one in a second, but talk to us about how we convince clinicians, and maybe Heather can chime in, nurses, to do those breach trainings. Any thoughts, anything you've seen that was like, this was a good, because we're supposed to do it, right? HIPAA requires ongoing training. Any hints there for people that are like, well, how do we get them to actually do it? They're busy, they're the most expensive, et cetera. We all know the reasons they don't.
So over the course of my career, I may have used a variety of incentives to convince people to take part in training. And, I know we all like to use the online solutions because you can track them, if people have attended training. I've found that a cocktail hour can be very effective and deliver that in person, lure the providers in, and again, it's an opportunity to tie different things together. Like, come hear about our new EHR upgrade and enhancements. And oh, by the way, you're going to have a quick cybersecurity training. So, finding those little hooks, convincing them that it's okay. And part of it is just being out in the trenches as a CMIO, being out in the workspaces and telling people you understand, talking to them about what's going on, hearing about their pain points, because then when you have to try to rope them into training, they're much more likely to participate because they feel that you're on their side and you're advocating for them.
Lures are usually a bad thing in security, but I guess in this case it's a good one. Go ahead.
I think so. Nurses are busy. I'm sure you all know of the staffing crisis. So we don't have time to go to another training. But it's important. So meet them where they are. You can literally go to the units and give them training hands-on. Teach them to recognize odd behavior, especially with the devices. One of the most vulnerable points in a hospital network is all the connected devices, and the biggest one with the most vulnerabilities, over 73%, are your IV pumps. Those are easily hacked. I had a former colleague went and did some observability and did a risk analysis. He was able to hack the IV pump in less than 5 minutes. So that's scary. Think if they had life-saving drips and medications that someone was adjusting. I mean, that could result in a patient's death. But one of the biggest things is make sure your password and your login is not admin. You would be shocked by how many of those are admin. Like, that is something that could be easily mitigated. So just teach them awareness. Parties are great. Don't offer pizza. Nurses are we don't want any more pizza.
Oh, that's good advice.
Candy, yes, candy.
Sandeep?
Yeah, and to Amanda's point earlier, you obviously want to share. Incentives work, right? But also on the flip side, physicians do want to. They are emotional when it comes to patient care. That's why they're in that job. When you start sharing the stats and data about how it's actually impacted patient care, for example, when the nurses station at a hospital goes down and they can monitor fetal heart rate and kids' lives are at risk, those are very important data points that once presented to the physicians in a manner that they see how it relates to their day-to-day, it can have a big impact. One of my friends who's a CISO, he's the one who actually explained that example to me on, hey, don't just make it all incentive based or just scary, but there has to be a mix where here's the reason why you should do this, the good as well as the bad. And I think a good healthy mix certainly helps physicians understand that better.
Yeah. Every good CISO I know is a good storyteller,
Yeah,
especially
absolutely.
to the board, right?
Yep.
Being able
Why
to
we
tell
need it,
those
yeah.
stories. George, I'd love to hear your thoughts. What measures could healthcare organizations, take to prepare for these cybersecurity attacks, including things like RTO and RPO, and and we talked about the staff training. Of course, anything you'd want to add there?
Yeah, I mean, I would want to reinforce kind of where I had put it before. I don't see organizations doing an RPO or let's say an RTO for a cyber event. It's best case or it's best ability because they're worried about, we don't know exactly what it's going to look like, so we don't want to put a time out there. And again, as I've mentioned, I think that's really bad for the clinical operations of the organization. Saying, we'll get it up and we'll get it back and recovered when we can get it back and recovered is just not a good capability. So again, you got to go back and make sure that your abilities as an IT team to recover your infrastructure, to have recovery plans, that they're tested, you feel confident about them, setting a time to make it a decision that you're going to pull the lever and say, we're shutting it all down, we're turning it off, and we're repaving. Don't necessarily try to fix it. Again, if you're really, really confident that your capabilities, you've got a cyber solution in place, you're going to get to a point and you're going to say it's going to be better to repave it than it is to rebuild it. So cut your losses, repave it, and then go. That's how you hit those times. So make sure you've got a measurement of what that decision point is of when you're going to stop trying to fix it, when you're going to stop trying to recover it, and you're going to start rebuilding it. And then you're going to have the mechanisms out of a clean room to be able to rebuild it very, very quickly. So lots of ways to do that. We have lots of use cases on best practices on how to do that, but it is possible to do it. Make sure you set an RTO for a cyber event.
Yeah. Heather or Amanda, he brings up an interesting point. How is it when you hear from your IT organization, we're not sure when it's coming back? What is that like?
Well, first of all, I think that's an unacceptable answer because as a clinician, it's a matter of life or death. You need information when you need it, where you need it. Data is gold. And when we can't access that information, again, we're running around and it's chaos. It literally is chaos. So any organizations out there that are in downtime and have suffered cyber attacks, just walk in there and see what the environment is like. And patients can pick up on that. They can tell when the clinicians are stressed. So that increases their anxiety. That's not good for, healing and getting patients, better to where we can discharge them and, they can be thriving. But also think about what's happening. It's putting distrust in the healthcare system in patients to where maybe they don't even want to go and seek care. And then I know that there's some stats out there showing that this could actually exacerbate public health crisis because they're not wanting to go and get treatment because they don't want their data to be stolen. And what's amazing to me is, patient data is selling for more in the black market than your social security and credit card numbers. It's a hot commodity right now. So it's very vulnerable. And going back to what they mentioned, it's not a matter of if, it's a matter of when you're going to get attacked. So you need to, plan ahead, be proactive. Don't wait until you're attacked and everything comes crashing down. I'm sure most people have heard of the horror stories. This actually happened in Germany in 2020, where a stroke, or it was an aortic aneurysm, which, as clinicians know, that's precious time. They have to be treated, very fast, just like a stroke patient. Due to a cyber attack, the ambulance was diverted away, and this patient ended up passing away. And they came out and said the cyber attack directly resulted in this patient's death. So, I mean, that's the reality. We need to be proactive and prevent patients from dying that they shouldn't be dying.
Yeah. Any questions from the audience that they'd like to ask? We'd definitely love to involve you if you have any specific questions. I would love to hear more about that patient side, right? I said we'd get back to it as well. Amanda, what was that like as a patient? I mean, it's interesting, you're a doctor, you're CMIO, you're that, but, talk about what it was like as a patient when the breach happened and the process and how they communicated or didn't, which I think is another important part of this whole discussion, right? Is how do we communicate with the doctor, with the nurses, and with the patients what's happening?
Yeah, and I think in the short-term downtime situations, the urgent attack, something goes wrong, talking earlier about how do we communicate and how do we communicate the SLA to get it back up. I think having those communication pathways in place beforehand is really important, and making sure that you get that communication just right. So don't communicate too much, don't communicate too little. And if you find that the plan is going off track, let people know sooner than later. If you tell them that the update's going to be in 2 hours, and after 10 minutes of that time has elapsed and you realize that this is much worse than it was, don't necessarily wait the whole 2 hours, because people are, we like to be naturally optimistic. We hope things are going to get better. And if you know for sure it's going to get way messier, we like to let it know. As far as the breach perspective as a patient, I actually found out about it through the generic letter that gets mailed to your house. And
very personal,
very personal, very made me feel welcomed by my health system, made me feel a part of the family. But you get this generic letter, and it's at least on the good side, they did offer credit monitoring services, which ultimately that's actually we caught the person trying to open the Discover card. We caught that incident. They didn't catch the person, but we knew it was going on, and so the systems worked as planned to help protect patients. But once of course I got the letter, and it just said, you're part of this data breach and here's what we're offering you. Well, then when the story came out in the newspaper and you heard what it really was, and it was the dumbest of dumb stuff, it was somebody downloaded an Excel spreadsheet with patient information on an unencrypted laptop in the trunk of their car that was stolen. I mean, that's really bad. That's, that was the kind of scenario we worried about years and years ago. This was not an aggressive cyber hacker. This was just dumb. And as a patient who knows a little bit about cybersecurity, I mean, that made me feel even worse. Like, okay, well, if they can't even control an unencrypted laptop, can I trust them for my cancer screening and all the other really important things? It breaks that relationship. It breaks that trust.
Yep, for sure. Sandeep, but you're 100% right? I mean, when the breach happens, you lose the trust of everything else, right? It's kind of the same way when we didn't have an EHR, you start to question wait, if they're not keeping up with technology to implement an EHR, what else aren't they keeping up with? Which may not even be fair. They might even be great at clinical care, but they start to wonder. And if you lose that trust, it's a problem.
I was just going to say that most of us are not doctors, but all of us are patients, right? So when something like this happens, we can relate to it. We know what the impact could be, and it certainly there's this emotional baggage that comes with it too. To Amanda's earlier point, which is, hey, how are these healthcare organizations set up? Can they even take care of me, or what's important to me? And besides that, as more and more healthcare institutions now are merging with larger institutions, right now you're creating these larger and larger conglomerates. So one vulnerability exposes the entire institution. Now all of a sudden the scale and the magnitude of that challenge becomes even bigger, right? So again, it's not an easy problem for healthcare organizations to solve, and that's why I guess it's a booming industry for helping healthcare organizations stay ahead of it. But yeah, as a patient, it certainly bothers you that it's out there, man. Somebody knows about it.
Yep. George?
Yeah, so I think we've talked a lot about what the impact is, but there are best practices out there. There are folks doing a good job in protecting their environment. I think we've all been part of. My son data when we were younger, and I had an organization that had just implemented EMR. His data was breached. So we've been watching out, and he's been on credit monitoring since he was 13 years old. So it does last through your whole life.
Wow.
But there are best practices. There are things you can do. And as we've talked about, I think there's the basics. First and foremost, security is a layered approach and everything we've talked about. But it's also really, really important that your cyber solution has best practices built into it. The FBI has made recommendations. ITIL has made recommendations. At Dell, we have a practice that's all surrounding this that can help you bring those. Rackspace has got it. All of that above. So it's not a lost cause. There are organizations fighting breaches every day and fighting them successfully. But it's all a part of a multilateral strategy that, again, promotes to the organization, look, first of all, as an IT department, like I said, we're confident. We know we can recover from it. Here's our RTO. Here's our recovery as an organization, and we'll go from there. So there are answers. It's not like it used to be back when I was part of this organization and brought in to help them through the breach back a few years back. So absolutely, we're happy to bring to the table what those best practices are.
Sandeep, maybe you could talk about Rackspace's approach to this, some of the best practices with your customers. And also, I love the idea, the question around this, right? And we've kind of gone back and forth, I think, with a lot of CIOs and CISOs as far as, is it safer to go with a third party because the third party has more resources to really invest at a high level? Or is it safer to keep it in-house where we're controlling it? Maybe add to that layer as well, which is always an interesting discussion.
Yeah, I think it's a combination of both. Organizations and us as Rackspace, we realize that there are going to be challenges that obviously we're trying to stay ahead of and we're trying to solve for, but we might need some help from some of our partners, right? So who do we lean into to solve a critical attack that happens to some of our customers, or a trend that's continuing with some sort of a cyber attack? From our perspective, what we looked at when we were working on our security offering, the most important thing was consumers these days are now used to using resources on a scale up, scale down fashion, right? Hey, I want to use I'll pay what I use for, and then after that, I wanted to turn it off. Why can't we bring that to security, right? So we launched what we call elastic engineering for security, and the whole premise is that hey, you can flex up and flex down as you need professional services for security, and then we can bring in obviously the right tools that you need, but the right people that are security experts and have all the certifications that you could possibly need. So, but it's not a one company or one company can solve all the problems. You're going to have to talk to your partners. We talk to Dell all the time about, hey, what are you seeing in the industry? Where can we be better? Where can we do things that are better than what we've done in the past? So that's the approach we take, and we extend to our customers as well.
Yeah.
One more.
Yeah.
Yeah, the last piece I would say, best practice, application centric. The vast majority of your applications in healthcare today are of an architecture that's older. It's not a modern application. So make sure what your cyber solution is looking at are those tier 0, tier 1 applications, the tier 0 that supports it, and make sure everybody's down the line is looking at it from an app support perspective, because that's what helps these guys back. Be confident about that. If you take that application-centric approach, you'll get to some of the best practices we're talking about.
Yeah. Heather, I don't know if you want to comment on the application, but I think that's a really interesting approach and key, because there are so many applications. It astounds me. I saw a small rural hospital that got acquired, and they said they had 1,000 applications. It's like application proliferation is real, and each of those is a point of vulnerability. But maybe also, I know NTT does a lot with 5G, has a private 5G network. Maybe you could comment on that too. I've heard a lot of people arguing 5G is actually more secure, which I think is interesting. But anyway, I'd love to hear your thoughts.
Oh yes, I love private 5G. So those of you in technology probably know Wi-Fi is just inherently not secure. We all know that. That is no secret. And every new application, legacy device, think of all the connected medical devices. An average hospital organization, they're managing over 350,000 connected devices, and it's actually probably more than that. Every single one of those connected to your Wi-Fi network, that is another vulnerability entry point, so they can easily attack that. So what private 5G does is It's truly a private network. The DoD, the U.S. Navy uses it, so they're only going to use the best, most secure. So it is truly dedicated private spectrum, the CBRS. It's dedicated to the enterprise, sits behind the firewall. Everything's encrypted. You have full control, visibility over that network traffic. It's device level authentication. You can do the micro segmentation, just that segmenting of your mission critical devices. So think of your critical communication, mobility devices, life-saving patient applications. Segment that on its own slice of the network. The stats show that alone can decrease those vulnerabilities on some of those legacy medical devices by 90%. Wow. So huge. You want that network to be secure, and that's something we can definitely deliver, and be happy to talk to you guys about it.
Yeah. Any questions from the audience? We've had a really robust conversation here. It's all shy. All these shy people. This guy wanted to be on camera, but he doesn't want to. No. Amanda, anything you'd add as far as, the idea? I think it's interesting too. There's breaches of data. There's breaches that just cause downtime, that you don't actually lose data, but you lose the system. What are some other, best practices you've seen in your organizations to be able to ensure, to George's point, that every application has a security plan, and then, obviously with limited resources that we all have, how do you approach that?
I think one of the things that's really important to that is just having a regular cycle for inventorying the different applications and how they're used. Because, when I hear organizations talk about they have 1,000 applications, 1,500 applications, what percentage of them are being used a lot? What are the 80-20 rule, and really trying to focus your resources on the places that are most vulnerable and the places that are most used. So every large academic medical center has some application that only one person uses, and it's probably a department chair who demanded it as a point of coming to this institution. That's going to need,
Is that the riskiest application? I don't.
It depends, because if it's an older application that's not being kept up because only one person is using it, it could be considerably riskier. But it's going to need a different recovery plan than the main EHR, and also making sure that those plans are including both ambulatory, inpatient, long-term acute care, all of the different areas in the appropriate tiers, and making part of that communication plan that I talked about earlier, making sure the ambulatory docs know that it's not that we don't care about you, it's that we have to get the ICU up first. And that's where leverage your CMIOs, leverage your folks that understand clinical informatics, go out there and help spread that message and kind of soothe those ruffled feathers when the people in the ambulatory offices figure out that they're not coming up first.
Yeah, that's interesting. George, maybe you could talk about, she highlights something really interesting, which is this application a risk to the rest of our network, which is one type of security, right? Like this one person using it that no one's monitoring or sitting under the desk. Hopefully we're getting rid of that, but sadly it's probably still happening, or the shadow IT that's happening that becomes a risk to your other applications, versus that I need to have a plan to recover my EHR, because if it's down, that's literally dollars out the door for my organization.
Yeah, it's going to keep happening. I don't think we're ever going to exercise shadow IT completely out of healthcare. I don't think we're going to ever exercise that chair or one of his key researchers using their own applications. So knowing that, what are you going to do? Network segmentation is one of those key pieces. Doing an application rationalization inventory is one of those key pieces. But even more importantly, I go back to the apps. Make sure your folks, your technical folks, as they're bringing up as part of a process or connecting somewhere, that application got plugged in. Where I see organizations really falling down is somebody calls the help desk and says, I need something connected to the network. And then there's not a change management process that kicks through saying, oh, what is that? CISOs go crazy over that when somebody can just plug something in or connect or download a new app to their servers when they're doing it for research. So you got to plan for it, and you have to plan multi-layers of devices and have the connectivity set up for those devices, security set up for those devices. Maybe that department chair, if he's got to only access, if he's got to have his app. I had a department chair that was similar to that once. I put them on the internet. And I gave him a Zen desktop to be able to access our network securely. And then I didn't care what he connected. And I also didn't let him download patient data. So at the end of the day, we ended up putting his app. We found out about the app. He had it loaded locally, as he always do, on a local server that we found out about that one of my technicians connected, bless his heart. And so it brought out a whole process that we had missed in this whole scenario. But we were able to give him his app, give it to him in a secure way, and then go from there. But we isolated him out of the main network because this was a repeatable pattern for him. So I was okay. That's all right. I'll give you the Zen desktop, but you can't download data you didn't have that capability, so you can't give up the PHI. Have that kind of plan in place for your researchers, for those users, because they're going to be out there and they're going to want to do their own thing.
Yeah. What I hear you saying is if we don't enable them, then they'll go figure it out themselves. I mean, that's shadow IT in a nutshell.
Yeah.
So we need to enable.
So when they do it, do it in a secure way.
Yeah, exactly. We need to enable them and give them. I mean, we see that in the cloud, right? I mean, I've seen cloud instances that are rolled out quickly so that researchers can have access to the CPU that they need, right? Or whatever it might be, because the best way to ensure security is to give them the technologies that they're asking for. If you don't, then they'll go figure it out themselves, and then you have no control. Yeah. So it's an interesting balance.
Yeah.
Sandeep, anything you'd add as far as application specific that you see with your customers, or other best practices you see as you work with your different organizations?
So all of them covered as tech experts pretty well on that, but there are other areas where our customers are looking at access logs, for example. Have the proper log management, have the proper security analytics when it comes to application levels. So, hey, where has it been accessed from? How long was the access for? Where was it coming from? Was it within our network or outside? So there's a lot of analytics that goes behind that as well, that customers are deploying and doing it successfully. So, yeah, I think a combination of all these steps and probably about 50 more are needed for an organization to be successful. But hey, as George pointed out earlier, it's not all gloom and doom. There are things that are being done in the right manner, and it's just a matter of CISOs, CIOs to be on the same page, and the physicians to buy into that as well.
Yeah. George, do you want to give us some final thoughts as we kind of wrap up here? This discussion has been a really, brilliant one. I've loved having the clinicians here, some more technical, some third-party providers perspective. But George, any final thoughts?
Yeah, again, I want to mention, there are best practices, right? There are lots of partners out there. Good networking helps. So make sure you talk, make sure you get that multi-layer plan in place, and make sure it's application-centric, and you'll be able to recover out of this. There are organizations that are being attacked every day. They are recovering. We don't hear about that because you can't. You don't want to let your security out, but it is happening every day. I have conversations with organizations that are getting attacked every day. They're isolating it. They're recovering quickly from it. So those best practices are out there, and there's folks that will help you get there.
That's awesome. Well, I guess the answer is you're not alone. We're all in this together. And ironically, cybersecurity is one area where there is no competition between healthcare organizations. They really want everyone to be secure. I don't know any cybersecurity person at a hospital that won't share everything with the other hospital. So, this needs to be a team effort for all of us battling against, these bad actors. So let's be here. Let's share our best practices and knowledge. Let's connect with even vendors, right? Vendors, as we've seen from this panel, have a depth of experience and knowledge that they can share together with peers and all of that. So, it takes all of us battling together to be able to do this. So thanks so much for taking part in this. Let's give a round of applause to our panelists and to Dell. And of course, be sure to check on social media, Transform HIT, where Dell Technologies is sharing just a ton of great healthcare IT content like that. And definitely come up. I think there's giveaways, is that right? And socks I saw around. So stick around for that and come say hi to our panelists. Thanks so much, everyone.